How to survive prison life. Landed in the big house? Survive prison life by following these do's and don'ts. You will need zipped lips, humility, restraint, and acceptance. Optional, courage. Step 1. Don't rat anyone out, ever. If you want to survive prison life, this is the #1 rule. Step 2. Forget what you've seen on TV about swaggering into prison like a tough guy so you won't get picked on. Acting like a badass is actually more likely to get you beaten up, because the established thugs will feel obligated to reassert their dominance. If you do get targeted for a smackdown, fight back to the best of your ability and try not to show fear. Step 3. If an inmate offers to give you something or do you a favor, politely decline. This is a common trick inmates use on newbies to get them into their debt, so they can extort a huge payback. Step 4. Don't join anything: a conversation, a mess hall table, a game of hoops, unless you're invited. Refrain from asking personal questions unless the other person has broached the subject first. Never ask an inmate what they're in for. Ask what they've been accused of. Step 5. Expect bad treatment from the guards if you're in for financial misdeeds, especially if you could once afford $6,000 shower curtains. These inmates tend to be assigned the most degrading jobs. Step 6. Assuming you're guilty, make peace with doing the time. Acceptance of your circumstances will help you survive prison life and plan for the future. Did you know? If an inmate tries to sneak in contraband via his rectum, it's known as keistering.
A culture is a way of life of a group of people that includes behaviors, beliefs, values, and symbols that they accept, generally without thinking about them, and that they are passed along by communication and imitation from one generation to the next. We see cultures all around us each and every day, and a separate culture also exists within the walls of a prison. So what is a prison? It is an institution of confinement of people where they are legally held as a punishment for crimes they have committed or while awaiting trial. According to the global research, there are approximately 2 million inmates in state, federal, and private prisons throughout the country. Within these institutions, there are a wide range of diversity that exists. There are a variety of men and women of all different ages and ethnicities who have committed various crimes on different levels. Each person has different educational levels, mental statuses, and socioeconomic statuses. All of these differences are important for prisoners because they must readjust and learn new norms, rules, and expected patterns of behavior. Things that are considered unacceptable in the free world may be encouraged and rewarded inside the walls of an institution.
A prison is an enclosed environment, meaning it is a small space compared to how many individuals it is attempting to accommodate, which has little access to outside its containing walls. Some prison cells come with one small window that has metal bars on it to prevent anything from coming in or going out. Other cells lack this window, for example in the case of solitary confinement. Many inmates are housed in a cell with multiple roommates, and some are housed alone, depending on what restrictions they have placed upon them. Although all facilities have varying schedules, all prisons are on a strict schedule similar to one another. Inmates are forced to follow it exactly how it is set, and may be punished if they do not abide. This is a sample schedule that shows just how strict they are based on different restrictions a prisoner might be categorized under. As you can see, prisoners are not given much time to complete tasks that someone outside of prison life may take a longer time to accomplish, for example, eating meals and showering. In most prisons, the meals are prepped and cooked by inmates. However, some places require employees to cook the food. The prisoners generally get about 20 to 30 minutes to eat their food and are kept on a strict schedule. The Federal Bureau of Prisons is who regulates the food served in prisons and actually requires kosher dietary restrictions to be incorporated into the meals for religious beliefs. Some prisoners give special meals for holidays, but some do not. Some prisons have attempted to cut costs by giving only 2 meals a day rather than 3 and not offering these special holiday meals. The incidence of serious mental illness is 2 to 4 times higher among prisoners than it is in the general population. In a study of more than 20,000 adults entering 5 local jails, researchers documented serious mental illnesses in 14.5% of the men and 31% of the women, which taken together comprises 16.9% of those studied, rates in excess of 3 to 6 times those found in the general population. While in prison, social interactions differ greatly from life outside of prison walls. Although the amount of interaction a prison may get varies between individuals, a general idea of their social interactions does exist. A prisoner may get some interaction while doing their daily chores, while out in the courtyard, or while eating their meals, for example. Some factors that may impact how much or how little social interactions a prisoner may have are if they have work privileges, are allowed visitors, mail, or phone calls, if they belong to a gang, or even the severity of their sentencing.
Not going outside will affect the prisoner's mental status the most because they are being restricted from going outside. Some people do not get affected by the prison life, but others get affected so much that they develop mental illnesses, especially when they have a longer sentence. When living in a restricted environment with so many people, they are more likely to contract diseases from other inmates much more rapidly than the general population because of the close proximity of the cells and using the same bathroom facilities with many different people that may already have diseases that are contagious to others. Prisons are not sanitary whatsoever, so this contributes to a lot of illnesses in jails. Most prisoners already had a communicable disease prior to entering the prison, but since healthcare in the prison is poor already, they will have even poorer health because their diseases and/or illnesses will become worse throughout the years of not getting properly seen by a healthcare professional. The food being served in the prisons from the previous menu example does show that prisoners get a balanced meal, but the problem is that the food is not enjoyable to eat. Usually the menus in the prisons sound decent to eat, but once they serve the tray of food, all the food looks like it's thrown all together and the food looks horrible to even eat. Prisoners have gone to hunger strikes because the food they ate in the prison made them ill. There has been documented data that there have been major illnesses in the prisons from the food being served. This will result into starvation and resulting in not having the proper nutrients for their health. In prison, inmates interact with each other depending if they are in a certain group in prison where they are allowed to be socially interacting. Depending if it's an all-man prison or all-woman prison, there will be correctional officers that will be of the same sex in jail that they can also interact with. An example to think of is that you go into a male prison, there aren't any women in there that the inmates can socially interact with. This really affects female nurses who go check up on prisoners' health because if a male prisoner who has not seen a woman for years will likely be violent or harass the female nurse while in there giving care to the prisoner.
Depending on the circumstance of each prisoner, activities and opportunities are offered while they are in custody. Educational opportunities are provided to each prisoner based on their circumstances. Employment in the prison is assigned based on the inmate's behaviors. Occasionally, inmates can request a certain job or chore, which must be approved by higher authority. Some of the employment opportunities include working in the kitchen, bakery, laundry room, tailor shop, community work, cleaning, woodwork shop, and working outside. Inmates' education is one of the most important aspects of the prison system. Higher education in prisons reduces recidivism and increases the safety and well-being of communities to which formerly incarcerated people return. With this being said, all institutions offer wellness education, adult continuing education, literacy classes, English as a second language, parenting classes, instruction and leisure time activities, and library services. Inmates who did not receive a high school diploma or GED certificate must participate in a literacy program for a minimum of 240 hours or until they obtain their GED. Vocational and occupational training programs are offered based on the inmate's needs. Some college courses are offered, however, inmates are responsible for funding this coursework. All prisoners in correctional institutions have access to health care, regardless of their custody level or security classification. If a prisoner has a healthcare need that cannot be met at their current facility, they will be transferred to a facility where their needs may be met. According to the Civil Rights Act, all patients can see a nurse if they are in pain, feeling ill, or experiencing anything abnormal.
Healthcare systems within prisons screen, monitor, and aid in the treatment of MRSA, tuberculosis, STDs, HIV or AIDS, and hepatitis. Chronic conditions and diseases are also monitored throughout an inmate's sentence, such as arthritis, asthma, cancer, diabetes, heart disease, and high blood pressure. In an attempt to treat patients and prevent the spread of influenza throughout the prison, isolation and quarantine methods are used. Confining patients who are sick with influenza will help prevent further transmission to other inmates. Symptoms must include having a fever of 100 degrees Fahrenheit or higher, plus either a cough or sore throat to be isolated or quarantined.
So are they patients or prisoners? This is one of the biggest challenges for nurses when it comes to dealing with inmates, setting aside their convictions and providing them with the care that they normally would for any individual. Not only do they have problems with stereotyping, but also worrying about their own safety as well as many of the boundaries that come along with dealing with prisoners, such as correctional nursing and versus nursing in a healthcare setting are not the same. For example, in a hospital, their primary goal is caring, and a nurse tends to work on one unit, generally sticking to one skill set with unlimited resources. However, working as a correctional nurse, that's not the case. Due to being in a restricted environment, healthcare is not the primary goal, where security and safety are. They have very limited resources with minimal help. Their practice is very diverse, dealing with all kinds of patients, so they must establish between many kinds of nursing with strong critical thinking skills. Every day for them is different and unpredictable, always being prepared for the worst. As nurses, we are expected to have a caring, non-biased, critical thinking perspective. Dealing with prisoners, they still apply the same skills but in a different mannerism with many boundaries. An example of the differences would be showing empathy. In a normal setting, you would possibly give that patient a hug or touch them as a gesture of caring, but when dealing with a prisoner, this could lead them to take advantage of you. By listening and setting aside their criminal history and focusing on their health can be just as effective as showing empathy.
Safety for nurses. It's important to be mindful of what nurses have unattended in exam rooms. Even a seemingly harmless roll of tape, she says, could be used as a weapon. It doesn't mean that weapon is to be used on you, but for many people, it's so they have something to protect themselves around should they get in trouble. In our prevention in prison, chronic care clinic visits include a review of systems, physical examination, asking about any new problems, reviewing recent diagnostic test results, ordering new labs and or x-rays, counseling the patients on their medications, diet, exercise, smoking cessation, weight loss, and disease processes, and referring them to physical therapy, optometry, brace and limb, dietary counseling, or to a specialty clinic if needed. Also, for the prevention of malnutrition, it is important to ensure that the nutritional needs of those in prison are met to prevent malnutrition and to promote healthy lifestyles among offenders. It is aimed at nurses who work with patients in the penal or young offender settings and places where nutrition is institutionally organized. Those working in such settings need to recognize the importance of promoting health among offenders and preventing health inequalities. And being advocates as a healthcare worker, it is essential that nurses are able to recognize malnutrition, provide nutritional advice where appropriate, and refer individuals to dietetic services for further assessment and treatment. Due to limited resources, nurses need to be primary advocates.
As you can see, prisoners are a unique population that have many differences. These differences are important to keep in mind because they can become barriers to the care that the nurse is providing to that patient.